So first of all, I want to thank Supernus Pharmaceuticals. Without our pharma companies, you all would not be able to be living so well without all these drugs that our doctors are prescribing to us. And Supernus has been a big supporter of ours, and we're very grateful to have them. I want to welcome our special doctors with us today. Dr. Alexander Shtilbans, we've been getting to know him over the last year, I think it is, Dr. Shtilbans. And Dr. Shtilbans is the director of the Movement Disorder Program at the Hospital for Special Surgery. He is a board-certified neurologist whose clinical interest lies in the area of neurodegenerative diseases, especially Parkinson's. He began his career as a molecular biologist in neuroscience, and after obtaining his PhD, he transitioned to clinical neurology in order to work with patients. We have a lot of patients and members at PWP who go to Dr. Shtilbans, and just by word of mouth, he has wonderful reviews. Dr. Shtilbans received his medical degree from Mount Sinai School of Medicine, where he also completed his residency in neurology and served as chief resident. He trained with Dr. Stanley Fahn during his clinical fellowship in movement disorders at Columbia University, and he is currently involved in several clinical trials in Parkinson's disease. Today, our theme is staying sharp, using our brains. And Dr. Shtilbans introduced us to Dr. Mariel Deutsch. And now I'd like to introduce you to our speaker who will be presenting this topic. Dr. Mariel Deutsch is a cognitive behavioral neurologist, specializing in the diagnosis and care of people with dementia and other causes for cognitive and behavioral symptoms. She has co-authored numerous peer-reviewed articles and abstracts, and she spent years working at academic centers, teaching the next generation of physicians, particularly in clinical research, and giving educational talks on various dementia and behavioral neurology-related topics, while providing exceptional clinical care both at Mount Sinai and Northwell Health. She now provides consultations in her private practice, Neurology Mind Care, on Long Island, a little bit far for all of us up here in Merrick. Dr. Deutsch believes in a comprehensive and holistic approach to care, and she gives her patients and their families all the time they need. I'd like to just have Dr. Shtilbans just say a few words on why he recommends us working with a cognitive behavior neurologist, and then we'll turn the floor over to Dr. Deutsch.
Thank you, Susan, for a wonderful introduction. And I want to welcome all the friends. The audience are my friends, and I've known some of you, and I'm happy to talk to and meet others who I haven't met yet.
Join the meeting.
It's great that Susan organizes all these talks, because it's an opportunity for sort of me to teach you something and for you to learn, and also to exchange ideas. I really learned from my patients a lot, and I appreciate the curiosity of your mind and interest, because it kind of gives me food for thought. And so I want to keep it as sort of a roundtable discussion, as opposed to just boring lectures to tell you, certain facts, because you inspire me by providing me with the feedback, with the inquisitive questions that you have, and so forth. So in any event, so I think this could be one of the series of lectures where we talk about different domains involved in Parkinson's disease. As you know, I'm a movement disorder neurologist specializing in Parkinson and other movement disorders, but I sort of direct care, if you wish, for someone who has Parkinson. And this is such a diverse condition that it unfortunately affects many aspects of one's life. And it might start with just tremor, a little bit of stiffness, slowness, but then in some folks, it can actually progress to involve other domains, if you wish, of our bodies, and that includes mind. So folks can become a little bit forgetful and so forth, and hence the cognitive neurologist involvement. Then some people develop problems with sleep. Some people develop problems with the autonomic nervous system, and their blood pressure fluctuates, or they have urinary issues, or constipation. So what I'm alluding to is that, so I'm aware of all the problems people might have, and I'm happy to be able to kind of guide you where, if needed, if you need to see a specialist, then absolutely I'll be able to provide you with appropriate person to see for particular problem if I'm not able to address that. If you wish, it's kind of being a primary care doctor for Parkinson's disease, that, you know, primary care doctor can refer you to gastroenterologist or for ENT if the need be, but essentially most and should start with primary care doctor. So Parkinson's disease is the same thing. It starts with movement disorder specialist, and then who is able to direct you in the right sort of avenue for care if you know, this is requires just subspecialty, if you wish, in that field. So, and I'm very happy that today Dr. Deutsch agreed to join us to really kind of shine light in the area of cognitive neurology, which is huge, and it's a separate training altogether. So after residency that we both completed, there is a subspecialty training. Like I underwent a training in movement disorders, and she trained in cognitive neurology. So dealing with all different cognitive problems that folks might experience, not necessarily from Parkinson's disease, but from other conditions as well. But I really welcome her expertise today to share with us, you know, about areas of cognitive deficits that might come about in folks with Parkinson's disease specifically, and what to do about it, how to, you know, get appropriate evaluation, and how to get appropriate treatment, because treatments do exist and they change with every month. There is a new drug here and there. You know, now we have 2 drugs for Alzheimer's disease already. We have a few drugs for ALS. We haven't gotten one for Parkinson yet that can slow down disease progression, but nonetheless, I'm very optimistic that we'll get it. So I don't want to steal any more time from Dr. Deutsch, you know, wonderful presentation I'm sure she'll have for us. So I just wanted to kind of give you an introduction that we could invite other subspecialists in other areas that are affected by Parkinson's disease, but I think we should start with probably the most important areas of the mind, the cognition. And so without further ado, I welcome again Dr. Deutsch, and thank you again for joining us.
Thank you so much. Thank you for inviting me. Let me just share my
I
screen.
will say that Dr. Deutsch will give us her presentation, and then please have your questions ready for the end. We'll take questions at the end.
Can you see my screen?
Yes.
Okay, great. All right, so staying sharp with Parkinson's. I'm going to first do a very quick overview of brain anatomy and healthy function, and then discuss some of the neurobehavioral changes in Parkinson's disease. And then the bulk of the talk is going to be modifiable risk factors that we can focus on for healthy brain aging and dementia prevention. So of course, just as a comment, you know, this is an educational talk, so please talk to your own doctors before, and maybe that's Dr. Shtilbans, before following any of the recommendations I'm discussing. Okay, so how does a healthy brain work? So in this cartoon, I just highlighted some the various lobes and major parts of the brain. So briefly, we have the frontal lobe, parietal lobe, temporal lobe, occipital lobe, cerebellum, and brainstem. And so in pink, the frontal lobe, that's the part of our brain that's mostly responsible for what we call executive function, which is problem solving, planning, organizing, also multitasking, our memory organization and retrieval, expressive language, some motor skills, behavior, emotional control, you know, a lot of things, right? The parietal lobe in yellow, that's the area more responsible for touch, for integrating all of our senses, math, reading, understanding our right from our left, our body orientation, and spatial awareness. In green, we have the temporal lobe. That's more for processing things that we hear. Also part of behavior, memory learning, and understanding language. And in the back, we have in purple, the occipital lobe. That's for processing what we see, for depth and color perception, and object and face recognition. And then in the orange-brown is the cerebellum. That's responsible for balance, coordinating our movements, cognitive and affective control. And then the brainstem is the more automatic stuff. So breathing, our consciousness, blood pressure, and heart rate regulation, temperature, digestion, and sleep. And just to overlay onto this, the areas that you don't see in this type of cartoon are well, a very important region in Parkinson's disease, a combination of regions that we call the basal ganglia, and that's really our motor control pathway. And it's responsible for initiating movement, for involuntary movements, motor planning and learning and sequencing, procedural memory, our estimation of time, habit formation, and reward-based learning. So very quick overview of all of that, because it's important to know, what is normal aging, right? There are a number of changes that occur as we get older. And so in normal aging, the brain decreases in volume, especially in the frontal and temporal lobes. And we have decreased brain blood flow. And we also develop certain cognitive changes that are just typical for age. So that would be a less attention span, our ability to multitask, our speed of thinking. These are all typical normal aging changes. But certain things that we don't expect to get worse over time with just age would be our skills, facts that we learned over time, our vocabulary, and our memory for faces. So what are some of the changes that you would expect to see in Parkinson's disease? So in addition to just the normal aging changes I mentioned, people with Parkinson's disease can develop some other changes. Attention and concentration, again. Processing speed also might be more decreased than what you might just expect for the typical normal aging. Executive function, so what I was mentioning before about problem solving, planning, organizing, multitasking, those could be areas that are a bit more vulnerable in people with Parkinson's disease. And then memory can also change, but it's different from the type of memory problems that you might see in somebody with Alzheimer's disease. So in Alzheimer's disease, a person has a lot of trouble learning and retaining new information. So it might be typical for a person to have a conversation and then a few minutes later, repeat the same conversation or repeat the same question. And no matter how many times they hear the answer, they still can't remember it. That's in Alzheimer's. In Parkinson's disease, it could be very different. The person might have trouble remembering something, but as soon as you might give a hint or a bit more detail, the memories come back. And so the memory is stored in there. It's just hard to kind of get the memory out. And then in Parkinson's disease, you could also have a decline in visuospatial ability. There are some behavioral changes that you could also see in Parkinson's disease, like depression, anxiety, irritability, false beliefs, or even hallucinations. And there's something called Parkinson's disease dementia. So that would be when a person has some of these cognitive and behavioral changes, but they're significant enough that it actually leads to a loss of independence and loss of the ability to carry out their activities as usual. And there some risk factors for dementia due to Parkinson's disease are age, having worse motor symptoms, and to have cognitive symptoms. So what can we do to try to prevent that, right? There's so many things actually that we can do to support healthy brain aging. And so in this cartoon, I depict all the things I'm going to go over in the coming slides about various modifiable risk factors for dementia. So first, physical exercise. So exercise has so many benefits. It can decrease neurodegenerative processes and increase neuroprotective effects in the brain. And specifically aerobic exercise, which is the type that really gets your heart rate up. That's been shown to improve in performance on cognitive testing. It's been associated with larger brain volume, less cerebrovascular disease, which is the brain blood vessel health. And aerobic exercise is also associated with a lower risk of mild cognitive impairment and dementia. Exercise could be as simple as just walking. So we've all heard about that random 10,000 steps per day number. You don't actually need that many steps per day in order to have a big health benefit. So in women specifically who were looked at, 4,400 steps per day was just that low, was associated with less mortality. And then looking in studies of men and women, even as few as 2,337 steps per day was associated with less cardiovascular mortality. And if you're looking specifically at trying to lower your risk of dementia, as few as 3,800 steps per day can do that. But the best decrease in dementia incidence was with 6,300 steps per day. And how fast a person has to walk in order for you to have like the best decrease in dementia incidence, it would be considered a pretty brisk walk. So certainly you don't need to be jogging, but more than a leisure walk. And exercise in Parkinson's disease specifically has many benefits. So I'll go through the 5 listed at the bottom of the slide. So in terms of the types of exercises, studies looked at stretching and resistance exercise, aerobic training, boxing, or balance. They found that if you do any of these types of exercises, 90 minutes for 2 to 3 times a week, that's been shown to improve balance, mobility, and quality of life in Parkinson's disease. In terms of using a treadmill, so high intensity treadmill exercise for 30 minutes with a brief warm up and a cool down, performed 4 times a week, that's been shown to potentially slow motor progression in Parkinson's disease. Walking on a treadmill rather than like the high intensity, but just walking on the treadmill for an hour a day, 3 times a week, that may improve cognitive function in Parkinson's disease, and specifically processing speed and attention and mental flexibility, which were those areas I mentioned earlier about being particularly vulnerable. Boxing, so boxing for 90 minutes, 2 to 3 times a week, has been shown to improve balance and gait and activities of daily living and quality of life. And then resistance exercise 3 days a week has been shown to improve slow wave sleep, which is important for memory consolidation and executive function. And I'm going to talk about sleep also in the coming slides. And as a plug, for the Parkinson's Wellness Project, you could see, my understanding from Susan is that many, if not all of these things are offered with you guys.
Thinking that maybe we should extend our hour class to 90 minutes when we do the boxing. Why does it say 90? What's wrong with an hour twice a week? Like they say.
These numbers were quoted from the articles that showed the benefit. So it was the benefit that showed, for that one, the improved balance, gait, and activities of daily living and quality of life. It was in the intervention that was 90 minutes.
We have to do that. Okay.
Okay, so next, moving on to mental exercise. So there's certain things we can't change now, right? So the number of years of education that we've achieved, the more number of years you've gone to school, you have a lower risk of dementia because there's a higher cognitive reserve. But there's still plenty of things you could do now outside of, going back to school, right? Continued mental stimulation is very important. And there's not any one form that's best. That could be something as simple as just having a meal with friends or family. And then, of course, getting into more complex things like pursuing hobbies that maybe you were always interested in but never devoted enough time to. Learning to play a new instrument or going back to an instrument you once knew how to play, or even just listening to music. Learning a new language, playing games, having just a daily outing, volunteering. So anything that really gets you thinking and, giving you that brain exercise is important. And I'm just going to highlight a few specific potentially for Parkinson's disease. None of these were specifically studied, but in terms of all the areas I mentioned before about being more vulnerable in Parkinson's, these would be some games that could kind of match that. So the game of Simon, that's that circle there with all the colors. That's a game that could help with visual attention and working memory. A memory matching game is good for attention and visual memory. A simple game of trivia that's important for memory, both memory for facts and knowledge, but also could help trigger a memory for, if you're hearing a fact, your brain might say, oh yeah, I remember when I learned that fact. Or I know that answer because I watched this episode of TV, and, you could bring up, you could visualize it in your mind. So that's helpful for memory. Problem solving and strategizing are used in playing chess and checkers. And it's important to recognize that there's not like one best game. And so a person should never push themselves to do something that makes them feel bad. So if tremor is particularly frustrating for a person, then, playing a game like Jenga, right, where you have to be careful about removing a block and not knocking the whole tower down, there's no reason to push oneself to get frustrated. You just should be doing things that you're enjoying that have the added benefit of being stimulating. In terms of brain game apps, most apps we don't think of as necessarily being like real life useful. So you might do better in the game performance, but we don't know that that's going to translate into real life. So nobody should ever forgo a fun experience with family or friends, or participating in something out of the house to just sit in a room by yourself doing some game app, right? But as an add, to add to like a a full activity schedule. There is one app that actually did show that there can be improvement in actual everyday performance and less development of dementia, and that app is called Brain HQ. There's a processing speed training app within, as one of the games within that whole app. And so if somebody's looking to download something to do when they're in the doctor's waiting room, or for a few minutes a day, right? This would be the one that's recommended, Brain HQ. Next, social engagement. So being socially isolated is defined as having less than one time per month interaction with family, friends, or religious organization, any organized group, or volunteering, right? So less than once a month is isolated, and isolation is a risk factor for dementia. So of course, the antidote to that would be to be active. And in Parkinson's disease specifically, social isolation has been associated with worse severity of symptoms and lower quality of life. And something that Susan was speaking to me about is that what she's heard often is that there's, sometimes a fear with Parkinson's disease that, I look different, and so I don't want to be around other people looking different. And one should never let that hold them back from living life, especially since most people are so self-absorbed. Nobody's looking at you. Everybody's thinking about how they look to other people. And so it's so important to make sure that, we remain socially engaged. Okay, next, dance. So dance has the benefit of combining all three: physical exercise, mental exercise, and social interaction. So you're getting everything in like a one-stop shop. And research in certain dance like tango, jazz, and folklore dance has shown improvements in a number of areas in Parkinson's. So movement initiation, balance, walking speed, strength, and quality of life. Okay. So next, in terms of other things that should be evaluated and managed to help prevent dementia and promote healthy brain aging, it's all the things we think about for heart health. Those are also very important for brain health. So that would include high blood pressure, high cholesterol, diabetes, and obesity. And then just some specific things to point out as it relates to Parkinson's disease. Although it's important to not have high blood pressure, people with Parkinson's disease may be prone to low blood pressure. So of course you want to be very careful not to overdo it with the medications, right? If you have Parkinson's disease, you may be prone to something called orthostatic hypotension, which is the tendency for blood pressure to drop when you stand. And so for some, it can be very tricky because, when you're sitting, you have a very high blood pressure, and then you stand, you have a low blood pressure. So, working with your doctor and even, specialist, potentially like a cardiologist, to make sure that the medications are managed properly so that you're not running into big highs and big lows. High cholesterol is no good for the blood vessels and in the heart and the brain. But again, in the theme of not overdoing it, actually studies have shown that higher LDL, which is like the bad cholesterol, has been associated with better executive function in Parkinson's disease. So that doesn't mean that you should ignore high blood pressure, but again, just not to, you don't overdo it. Lowest effective doses of medications, or if it could be managed with, diet and exercise, even better. Diabetes. So Parkinson's disease progression has been shown to be worse in people with diabetes, so just another reason to make sure that that's managed properly. And also motor progression in Parkinson's has been shown to be worse in people who are overweight or obese. Okay, next, in terms of substance use, so there's no safe amount of cigarette use. So for those who smoke, of course, the goal hopefully would be to quit. Alcohol is tricky. There are definitely mixed studies on this. There's some articles that suggest there's no safe amount of alcohol. Others suggest that, for example, 1 glass of wine a day might be okay. But in Parkinson's, it gets more complex because actually chronic alcohol use can lower dopamine levels, which can worsen Parkinson's symptoms. And also there could be medication interactions with alcohol, and that could decrease the effectiveness of the medications. And then of course, potentially increase the risk of confusion. And then while a person is intoxicated, obviously you increase the risk of confusion and falls. So certainly nobody should take up drinking because somebody says maybe a glass of wine, might be beneficial for brain health. And in those who do drink, the goal would be to try to, limit it. So if a person's used to having a glass of wine with dinner, and then they notice that with Parkinson's disease, they're actually not They feel like a cheaper date, right? Like they have actually a bit of symptoms that they wouldn't expect with just one glass of wine, then you, of course, would decrease, if not eliminate, the wine. And then recreational drugs, of course, there's no safe amount of that either. Now, moving on to sleep. Sleep is so important for brain health. Sleep in terms of quality and quantity. So to talk about quality first, it's very important to be evaluated for sleep apnea if there are any symptoms. And symptoms can include snoring, waking up in the middle of the night, having interrupted sleep, not feeling well rested in the morning, falling asleep very easily. And really, in the past, I used to be a bit pickier about who I sent for sleep apnea testing. I'm really not picky at all now because it's just so common. It's the test itself is maybe one inconvenient night to be tested, right? But the benefit is huge. If you find out you have sleep apnea, then there's actually something easy to treat that can lower your risk for dementia, as well as lowering your risk for heart disease and atrial fibrillation and kidney disease, and quite honestly, sudden death while you sleep. There's like so many negatives to untreated sleep apnea. So to be tested is so simple and such a benefit if you find that you have it, because now you could do something about it. And in terms of some specifics, if you have sleep apnea, you have less slow wave sleep. And slow wave sleep, that's that deep sleep where memory consolidation occurs. So just even in terms of like short-term problems, you're not consolidating memories as well on the nights that you're not having proper sleep, right? But in terms of the long-term problem, you're having this chronic low oxygen potentially, and that is a risk factor for dementia. And specifically, there's Alzheimer's disease pathologic changes that can be promoted when a person has sleep apnea. So many reasons for a person to be evaluated. So from the quality perspective, and then another sleep condition that one could be tested for when they have a sleep study is also REM sleep behavior disorder, which, as we all know, is very common in Parkinson's disease and is associated with worse cognitive symptoms. And then from the quantity perspective, having 6 hours or less of sleep is associated with a higher dementia risk. So the goal would be to try to get to a target of at least 7 to 8 hours. Okay, next is diet. So the most brain healthy diet we know of is called the MIND diet. That's based on the Mediterranean diet and something called the DASH diet, which was developed for people with high blood pressure. And it's a diet that emphasizes 10 brain healthy foods and limiting 5 unhealthy foods. So it's green leafy vegetables, nuts, berries, olive oil, chicken, fish, beans, all things that we just inherently know, like, those are healthy foods, actually, can improve brain health. And trying to minimize red meats, fried foods, pastries, cheese, butter, right? So people who followed this type of diet had less cognitive decline over time. Specifically, also less development of Alzheimer's disease was shown. I'm not aware of it being tested in Parkinson's disease specifically, but I will point out that in Parkinson's, one thing to be aware of is that, my understanding is that we want to watch the protein and iron in the foods that you're eating, because it could interfere with some of the medications like the carbidopa, levodopa. And also, of course, if a person's having some swallowing issues, you want to watch, the types of foods that you're eating. But in terms of, what are the types of foods that we should be stocking our kitchen with for brain health, this is the diet that's best to model. Okay, and then what about vitamins and supplements? Well, there's not any quick fix, right? There's not any of these supplements that say that they can improve memory. They sound wonderful, but they're not actually proven. And so I don't recommend using any of these non-FDA approved supplements specifically for helping memory. But that's different from if a person has a vitamin deficiency. So there are a number of vitamin deficiencies that can be associated with memory loss. And so in any workup for a memory issue, checking for these vitamins is just standard of care. And then if a person is low, supplementing that vitamin is important. It's very important. And if a person's not deficient, there isn't any proof that taking excessive levels of particular vitamins is helpful, though. And then recently, there was a study that was funded by Centrum Silver that showed that if you take their vitamin, Centrum Silver, actually there may be improved cognitive function. It was a study that was looked at for over 3 years, and people had better outcomes. It was healthy older adults, so not specific for Parkinson's disease. And most people tend to take a vitamin. So I have been recommending that as long as a person's doctor doesn't see a reason for them not to be able to take a multivitamin, maybe that would be helpful. But certainly none of the ones that are touted as, memory improving, those don't have the same amount of benefit proven behind them. Okay, next, a really huge and important topic is mood and stress. So depression, anxiety, and stress, these are all risk factors for dementia, but also very common in Parkinson's, very common in general, but also very common in Parkinson's disease. And there's many reasons for this, but I like to explain it to people that, we all only have so much mental energy. And so if your mental energy is kind of hijacked by your ruminations over what you did the other day that, you're still upset about, or your worries about the future, then you're not having any mental energy to kind of commit to the moment. So if somebody is having a conversation with you and they just introduce themselves to you, you might not remember their name because you barely heard it, right? Because your head is, totally somewhere else. Or you walk into a room and you completely forget why, because again, your mind is really not there. And so, when we have this type of trapped mental energy, the goal is to try to free that up. And so there's a number of ways to do that. Of course, the main thing is to treat the underlying mood that's contributing to that lack of mindfulness and the stress. But then there's also, so that would be in the form of seeing a therapist. Some people require psychiatric medication for mood. Other people need to just do talk therapy. And of course, the combination of medication and therapy has been shown to be most beneficial for conditions like depression and anxiety. But there's things that we could also do on our own to try to improve mindfulness, and that would be meditation. So meditation, there's many different types. The goal for any of these types of meditation is to just reach a state of relaxation and calm presence in the moment. And it's been shown to decrease stress, anxiety, depression, all these things that, take us out of being mindful, and to improve psychological well-being. It may also improve focus and memory. And then studies have shown that meditation has been associated with altered brain volume and network activity and functional connectivity. So actual, brain changes that are important. And meditation can calm the sympathetic nervous system, which is that fight or flight mode that we get into. So I'm just going to highlight 2 types of meditation that can be helpful. One you could find as a free course that's on YouTube. The website's listed there. It's called Pwp Mindfulness. It's an 8-week course, and this was actually specifically studied in Parkinson's, not the free one online. That's the more like the big one. But a study looked at a modified version of that course, and modified meaning it was like, so in this case, it's 8 weekly sessions. Each session's 1.5 hours. In the full course, I think the sessions were like 2.5 hours. And in the full course, it was like daily homework, whereas in this modified session for Parkinson's patients, it was the homework was only 20 minutes twice a week. But they found that in people who went through this 8-week course, there was decreased depression and better emotional stability. So that's one free option. And then the one that I have experience with is transcendental meditation. You could find somebody to teach this at tm.org. This is something that is mantra-based. So you're taught a mantra, and then the meditation is quite simple. You just literally in your mind say the mantra for 20 minutes. And you're supposed to do this twice a day. And again, the goal is in this one to transcend the process of thought and reach this state of deep inner calm. And so while a person's meditating, they might feel calm, and that's great. But what about afterwards, right? And the point is that even beyond the period of time that you're doing these the meditation, you can become less reactive, right, and more present in the moment. And so that what we were talking about, that like trapped mental energy, right, that can be improved. And so of course, then the cognitive errors that were caused by the lack of mindfulness would melt away. Okay, next, accidents. So we know Parkinson's specifically, there's a number, traumatic brain injury is a risk factor for Parkinsonism and dementia. But in terms of what we could do now, preventing falls is a big deal, because if a person, especially one with Parkinson's disease, has a fall, breaks a bone, that often is a big turning point in a person's life. When in the hospital, you might be prone to delirium, and then delirium in and of itself is a risk factor for dementia. And then while hospitalized, the person can experience worse motor function, and including swallowing function, as well as worse cognitive symptoms. And then while you're in the hospital, you are increased risk of exposure to medications that can worsen the symptoms. So sometimes it's this terrible cycle. So trying to prevent accidents in the first place is so important. Okay, optimizing the senses, that would be, we're thinking about like hearing and vision loss, right? So both hearing and vision loss are risk factors for dementia. So this is relatively easy. You get your hearing and your vision checked and make sure if you need hearing aids or new prescription, then, we do that. There's a number of reasons for this, but so when we think about hearing loss, there's a few reasons that it could affect cognitive function. So one is, of course, you're not remembering what you don't hear. So if you have a conversation with someone and you barely heard what they said and you don't remember it later, it could look like you have a memory problem, but you just didn't hear them. The next is that if you're spending so much of your mental resources on just the simple act of hearing, then you have less resources available to committing that information to memory. And then also, if you're not, the less stimulation we have from, hearing, right? Your brain gets less activated in those relevant regions, and then it's a use it or lose it principle. So your brain, the parts of your brain that connect to, hearing will decrease, and you have accelerated brain atrophy there. And then also people are more isolated when they can't see or hear well. And the social isolation, as we discussed already, is in and of itself is a risk factor for dementia. Okay. Next, avoid toxins. So of course there's toxins that are specifically carry a risk of increased Parkinson's disease or Parkinsonism. And then separately also various toxins have been associated with an increased risk for dementia. So of course, a number of these things that we can't control right now, like, the amount of air pollution in our environment. But just, as a comment about other risk factors for dementia. And then finally, medications. So certain medications can worsen cognition and increase dementia risk. And unfortunately, a lot of these are the ones that tend to be prescribed in Parkinson's disease because, they're prescribed with good reason because it can help the symptoms, but it's very important to be aware of the potential side effects and then to work closely with the doctor on making sure that you're forthcoming about, what symptoms you might be experiencing so that you're not accidentally staying on a drug that can make things worse overall. And so some of the medicines that are maybe prescribed for the motor symptoms of Parkinson's disease, like cogentin and artane, those can worsen cognition. The overactive bladder pills like Vesicare and Ditropan, those may be no good. Depression and insomnia pills like Elavil and Pamelor, and then Benadryl, which is contained in a number of, it could be by itself, or if you purchase any of the PM drugs at the drugstore, like Tylenol PM or Advil PM, those all have Benadryl in them, and those are no good. And then Klonopin, which is commonly prescribed in REM sleep behavior disorder or for anxiety, that also it really can worsen cognition. Okay, so my take-home message is that Parkinson's disease may be associated with a number of cognitive changes, but I went through at least 20 lifestyle, medical, and environmental factors that we can actively address to improve brain health and help protect against dementia. So a bunch of references, and I want to just say thank you again to Susan and Dr. Shtilbans, and this is my contact information.
Thank you so much, Dr. Deutsch. That looks like a beautiful office. I wish you were closer.
Oh, thanks. Thank you.
Eric. Yeah. That's a lot of information for us. And, it's almost like we have to commit to changing our lifestyle. you know, because what we grew up is so different than a lot of these things. And there are a lot of foods out there and toxins out there that, you know, I walked into my friend's house the other day and, you know, when you, the sense of smell is not strong for people with Parkinson's. Correct me if I'm wrong, Dr. Shtilbans. I think they lose their sense of smell. And I walked into my friend's house and I smelled a lot of cleaning toxins. It affected me. It affect her because she wasn't smelling it. Those are all like simple things to look and to make sure that you're using the proper cleaning things in your home.
Yeah, that's an excellent point.
Yeah. I'd love to take questions. I'm sure that we have plenty of questions. Somebody said, "Oh, how is reading when you're reading? How does reading help your brain function improvement?"
Oh yeah, I didn't specifically highlight reading, but that's absolutely. There's, you know, many cognitive processes involved in reading. Of course, you're stimulating the language areas, but also attention and memory, right? If you're reading a book where you have to remember the characters from the beginning, you know, in order for it to be enjoyable. If people have problems where that can be more tricky, then just, you know, have a journal where you would take notes to remind yourself of, you know, who the character is, right? So some people, if they find that whether it's their vision or just their processing of words on a page is troublesome, then switching to audiobooks could be helpful. So, you know, even if just, you know, if you love the stories, but the physical active reading has become difficult right now with audiobooks, that you could still, you know, enjoy it, but in a different way.
What if you like you open a book and you're not tired, but then you start reading and you fall asleep, like you get sleepy? And
yeah, I mean, some people read, so it depends, you know. I always read before bed, and it depends. I know for myself, if I go past a certain amount of time, it'll be like an extra hour before I'll be tired again, right? And of course, it also depends on what you read, right? Because we go into these cycles where, like, if you miss that wave of sleepiness and you power through it, it's like you have to wait for the next wave of sleepiness. So so it's not like a person should purposely read or not read at night, but reading reading could definitely be part of a cognitively, you know, stimulating experience.
I have one question about sleep. If you sleep, let's say you sleep a chunk of 5 hours, then you wake up and you don't fall asleep for another hour, but then you get 2 more hours in 2 hours from then. Does that count as 6 or 7 hours?
I'd have to look back at the articles I quoted that mentioned the 6 hours, but to give you an exact answer to that question, but conceptually, it is important to have uninterrupted sleep. And so the question really is, why is the sleep interrupted? Is, you know, a lot of people will wake up overnight to use the bathroom and their assumption is it's a bladder issue, but sleep apnea can cause a person to wake up and overnight. And then once you're awake, you know that your bladder's full and then you use the bathroom. And so some people are falsely reassured into thinking, you know, oh, I don't have sleep apnea, but then actually it turns out that they do. And then they won't wake up overnight to urinate when they get the sleep apnea treated. If you're waking up overnight because the room is too hot or because your clothes are too tight or, you know, your bed's uncomfortable or your partner snores, right? Or there's too much outside noise coming that, you know, you're hearing. These are all things that are so easily modified, like earplugs or white noise machine or, you know, better mattress, cooler clothing. Most people leave the temperature too hot. You know, it's better to sleep in a colder room. So there's a lot of sleep hygiene things that could be modified also.
Actually, is there a temperature that you recommend to people at night? Because they do.
I don't remember the exact, I feel like 67 was sticking out to me. I don't remember the exact number, but I think, you know, I think that's like it's 67 or even below. Like it's, you know, 68, 69. That's
My
not.
father used to keep his
warm.
temperature growing up at 58. So I was like, at night, everybody 58.
Right. I mean, most people notice when it's freezing, they sleep better. But it's true.
Okay, let's see.
By lowering the temperature.
What you do on Klonopin, baclofen, I have REM sleep disorder plus urinary now.
That's me.
Oh.
Well, for example, like the triple whammy,
I don't really want to take now the urine, the thing to stop the urine from happening at night, like waking up at night, definitely because of that. I've tried everything to decrease that issue. I want to take myself off
Wait,
Klonopin, but then
Karen, did you do
what do you do?
Did you do what Dr. Shtilbans recommended, was have pickle juice? Right, Dr.
Well,
Shtilbans?
I'm drinking LMT, like salt in my water. I have orthostatic hypotension. There's a lot going on. But I want to like almost, what do you think about these? Like, could I possibly wean myself off Klonopin and then just take like a natural herbal sleep remedy, like one of those with GABA, valerian, the L-theanine? There are natural alternatives all over Instagram, for example. Like,
No, wait, it sounds
I-
like Dr. Deutsch, Karen, let me interrupt. Dr. Joyce, I think Dr. Deutsch recommended that website, and maybe that course of the meditation would be very good for you.
well, I
don't-
know, but like
jumping in here.
dystonia, and then they give you baclofen. I feel like I'm on all these things that I don't want to be on.
There's
Like, I'm
another
already-
sleep. There's another sleep specific course called Go to Sleep with an exclamation point. I don't know a lot about that, but I remember the sleep doctors I worked with, like shared patients with regularly, would recommend that to people. And then there's also an app called Calm, which is like
Yeah, I've
bedtime
tried
stories.
everything.
You know?
How do you wean yourself off Klonopin if you're already on it?
Carefully.
Like, what do you do?
Dr.
I heard somebody chime in
Shtilbans,
carefully. I thought that was a cute comment.
Dr. Shtilbans,
Yes.
how do you wean yourself off Klonopin? Is that something you want to answer?
Yeah,
Well,
like
the-
I'm on it. So now what? It's like,
The question is why you were in the Klonopin in the first place. As I said, I can't kind of give personal advice, but overall, the Klonopin is a good drug. I mean, you just have to realize that it all depends on the dose. So obviously, long-term exposure to high doses of Klonopin can cause to cognitive problems, memory loss, absolutely, impotence for men, absolutely. So, but smaller doses, when they're used appropriately, I'm talking about 0.25 milligrams for REM sleep behavioral disorder, can save your wife from having a blue eye and from you falling off the bed and actually breaking a hip. So
I was afraid you were going to punch me during the night.
all has to be do sort of in conjunction risk versus benefit. Now, if one were to taper off Klonopin, I would recommend doing it slowly. I would reduce it by probably 1/4 milligram every week. So let's say if someone is 1 milligram, you'll go down to 0.75 for a week, then 0.5 for a week, and then 1/4 milligram for a week, and then stop it. So
Not purposely,
people don't abuse drugs that are given appropriately under supervision of a doctor.
Thank you. Amy, do you have a question?
Yes, I have a quick question. What would you say to someone who has Parkinson's, a lot of movement disorder with it, who is spending much of the day eating a lot of junk food that they buy on Amazon?
Yeah, well,
Sounds like her
I think
husband.
they need to see a
Different.
specialist in the field. And so some medications for Parkinson's disease, unfortunately, can cause impulsivity, impulse control problems. And those are dopamine agonists. And I don't know if that person is taking dopamine agonists, but certainly they are known to actually cause urge to eat junk food and sweets, ice cream at night, and other things. And these are dopamine agonists. So this is the side effect of certain Parkinson medications. So again, that needs to be investigated. If this is irrelevant, maybe that person has been eating on junk food all their life. I mean, I don't know. So it's a little bit of a general question, and I think it's
The other thing is there's certain types of dementia associated with Parkinson's symptoms where that's a very common thing. So something called behavioral variant frontotemporal dementia, very common for a person to develop a craving for sweets, and a certain percentage of people with that condition can have Parkinson's-like symptoms. So,
Would you want to make some changes and try to incorporate more things from that mind diet in our diet? I
Oh,
said,
Well,
help.
I mean, that would be ideal, but I can't necessarily control someone else's eating choices. So I just want to know what sort of things should I be bringing up when I talk to her, but I think it's really a discussion for her personal neurologist.
Be Hawaii.
What?
Could be Hawaii.
It could be.
Yeah,
Is,
fine.
is Centrum Silver a vitamin company?
Centrum's the brand, and then the silver is the version for people over 65. Or I don't know if it's the specific number, but the older people.
And is that a multivitamin?
Yeah.
Mhm.
So that's one of many brands of multivitamins. They happen to be the one that
There's a
funded the
lot.
study. So I'm not
Yes.
aware that there's
one of-
something so specific
I don't
about
know.
that
for-
multivitamin compared to the others. But that was the specific pill that was used in the study.
I think she's.
Any other hands up? Anybody want to ask a question? Mrs. Bausk, you look like you have, Mr. Dumbrell?
You have a question? Oh. No.
He was just testing out the system.
Oh, he has a question.
You have a question? No.
Okay.
Didn't
Do
realize
you
it.
have a question, Jean?
I don't have any. It was a fabulous presentation.
Yes, thank you.
Very, very
Really
good.
was.
You covered everything that's important for someone dealing with Parkinson's who's self-motivated to do all the things that you're suggesting. It's very hard to get people motivated, but it's really important. So thank you so much.
Thank
Jean,
you.
yeah, that is our biggest issue, motivation, really. And if anybody has any ideas about that, you have to want to feel good. You have to want to feel better, you know. So doing these, right?
But it's also a lot of work for what you suggested between people who are not used to food prep and buying and choosing the way you're suggesting, and people who are not self-motivated, which takes a lot of time to get involved in the exercise programs. But it is really important, and people make choices about how they want to handle this disease.
Right.
And some of the motivation aspect also could be out of your control because Parkinson's disease can affect our ability to be motivated. So also one shouldn't be so hard on themselves because the disease in and of itself is making it harder for you to actually do the things that, we know could be beneficial.
Is there anything that you know of that can help with that apathy or that? No, you're shaking.
So, you can, if you structure things, you could at least remove one of the initial barriers. So if you know you have a plan that you want to do X, Y, and Z, and you're dealing with apathy, you're not going to accomplish X, Y, and Z unless you really plan for it. So I tell people even put exercise on the calendar, even though you might not typically, you put a doctor's appointment on the calendar, right? You put certain appointments with a date and a time on a calendar, but you should actually put things that you want to do on the calendar, even though it might not be something that would be typically scheduled in, because you show up to your doctor's appointments. It's just a given, right? And so you're more likely to show up for the things that you might otherwise skip because of the apathy. So really, you could try to overcome that just with being more structured, and then also enlist help from another person. I often tell a spouse who would be who's unaffected, if we know that this is a person's vulnerable area, then, they could take charge a little bit to say, okay, tomorrow, are we doing X or Y? Rather than saying, do you want to go to X? Because if you say, do you want to, you might get a no. But if you say, are we doing X or Y? Or if you're saying, do we want to go to X before or after lunch? Right. Then the answer inherent in the question is we're doing something. And so that could also be helpful, just the way people approach the subject where, we're doing something. It's just, you pick which, or you pick when, and take the no out of the equation.
Somebody gave me this very good advice that I'm actually doing for myself. You could do this with exercise. You print out a blank calendar and you put it on your refrigerator. And after you do this thing, your goal that let's say you want to exercise, you check off on that day that you did it. So you literally see that you did it. It helps you. you have to plan that that's what you're going to do. And then you give yourself a reward, you know, let's give ourselves some rewards for the little things that we're doing, right?
I love that, and I love checks. I love check boxes.
I
Yeah,
find
maybe-
it's helpful with my clients instead of just saying,
Cereal?
put
That could be
whatever on the
reward, but-
calendar, that we're gonna put it on the calendar at a time. So
Yeah.
after breakfast, we're going to exercise, or after lunch, we're going to do this. So that it's scheduled at a specific time of day, so that this is how we're doing things.
Definitely.
Wait, did you check?
And after you do it for a while, it becomes a habit.
Okay, I
So
gotta
you want to
undo it.
make
I'm
those
on
good
this thing.
habits, right?
Yeah,
Mhm.
it's hard, like Dr. Deutsch said, when you've got a client who's dealing with all of the, like, maybe anxiety and depression and issues, cognitive issues that come with Parkinson's, to do that. So I love the calendar, write it down.
I think that also all the things that you pointed on, Dr. Deutsch, are all things that we have to take seriously. From sleep to breathing, you know, eating right. It sounds simple, but these are things that we have to.
Right. Like most people say, when the context of dementia, people always say, "Oh, nothing can be done," and that's not true. I mean, if you're talking about a pill that you take that reverses everything and prevents anything, yes, okay, fine, you're right, not yet. But there's a million things, well, or 20 plus, not a million, but there's so many things that actually you can do and you could focus on, and they're pretty easily attainable. Well, it's simple in theory, not easy to enact, but simple in theory, simple enough in theory. And just start chipping away, have a plan, and then you just chip away at each one.
Right. Well, thank you so much, Dr. Deutsch. Thank you, Dr. Shtilbans, for being here with us and introducing us to Dr. Deutsch also. I really appreciate your time and your great knowledge. You're helping us so much. I want to say that I want to give let you know two things. January 14th, it's a Sunday. We're having a neurologist from Dubai come and talk to us about breathing. Breathing, the simple act of breathing, how important it is for us. And so that's going to be on a Sunday morning because they're over there on the other side of the world. So we have to work with their clock. And then in January, the end of January, we have through January 22nd through February 12th, 4 Monday nights, we're doing a nutrition workshop. It's in the evening, and it's all the easy one-pot meals, how to work in the kitchen, how to plan your meals, and all the good foods that we need to eat. So I hope that you'll join us for that. And lovely seeing all of you here today.